Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the WHO program to control the trachoma. WHO program for the trachoma. So what does it include? It is nothing but it is known as a SAFE strategy. So let's dive into this. So first one is S. The S here stands for the surgery. So what under surgery? Surgery means they can be trichiasis or the entropion correction surgery, which is a tertiary prevention. So you do a trichiasis as well as the entropion. So trichiasis and the entropion correction surgery is what is done. Next, when you look at the antibiotics. So what happens in case of antibiotics? Antibiotics, there is use of azithromycin. So there's use of azithro as well as the topical 1% tetracycline. There is tetracycline as well as the topical 1% azithromycin. So oral azithromycin and topical 1% tetracycline. Next, there is also the use of the topical 1% azithromycin. All this forms a part of the secondary prevention. There's also the topical azithromycin. All this forms a part of the secondary prevention. Next, we move on to F. So this F, it stands for what? It stands for the facial hygiene. So F for facial hygiene, this is nothing but the primary. F stands for the primary prevention, that is facial hygiene. Next is E. What does this E stands for? The environmental cleanliness. This is the primordial prevention. So E here stands for the environmental cleanliness. So this strategy depends on the prevalence of trachoma follicle in children aged 1 to 9 years. So what happens in case it is greater than 10%? In case it is greater than 10%, more than 10%, then we give mass antibiotics. Mass antibiotic treatment at the community level and the FE measures, that is the facial hygiene and the environmental cleanliness. So you do a mass antibiotic as well as the facial and the environmental cleanliness. Next is, what if it is between 5 to 10? This is a nice question. 5 to 10, you do a targeted antibiotic treatment. That is only the affected families. So you do a particular target treatment is what is done. Next, if it is less than 5. So less than 5. So here, when it is less than 5, what we do is we do a facial and the environmental cleanliness. So facial as well as the environmental cleanliness is what is focused on. To learn and grow daily like this, please do subscribe.